Gay City's been around for 25 years. It was just the other day that I got a phone call. There were no texts back then. It was a phone call from John about, trying to create this.
In terms of looking at the notable accomplishments of Gay City over these past 25 years, I would say the creation of the Wellness Center would almost certainly be at the top of that list.
The Wellness Center is amazing, and I'm so excited about it, and I'm most excited about the continual growth of the Wellness Center. But there is a precursor to the Wellness Center. Seattle Gay Clinic was, again, a program that started out as a small program, actually, I believe, for hepatitis B in the late 70s. And Seattle Gay Clinic was housed at the Country Doctor Community Clinic. Seattle Gay Clinic really was wondering, can we continue to exist the way we have been doing, sort of this independent that all we do is HIV testing and STD screening? And there's Gay City Health Project was perfect, and it became this lovely marriage that now has become the Wellness Center. And
community response was immediate. It was, we were busy from day one. We haven't experienced a non-busy time period at the clinic at all.
20 years ago, our push was to try and get people who were at risk for HIV to test more frequently and to test if they'd never tested before. And one of the things that we realized as people tested more and more was that antibody testing isn't perfect. All HIV testing has a window period. So it became a push that then became adopted by the Centers for Disease Control and Prevention to really focus on recognizing people with recent infection. Because again, they're most infectious. You can identify people very early in their course of HIV and hopefully have a greater impact on their life.
I think one of the beautiful things that I've seen with the agency is the agency's growth, actually, and just in terms of like internal capacity and what that means for showing up for others. Our key thing isn't just to kind of be very transactional to get people in and get people out. It's really listening to people. What do you actually need, right? Because it may mean that you come into the Wellness Center and sometimes it's coming in and you just want to know about PrEP. You want to know how you can advocate for yourself, how you can support yourself and your loved ones as far as your sexual strategies. So I love that the Wellness Center allows us to, one, really just connect with people in community. Things that we're hoping to do is have home testing kits, because what that will allow us to do is for folks who live in rural areas who may be afraid of going into their local urgent care, local physician, because maybe there's, instead of 6 degrees, there may be 2 degrees between you and someone I know, right? Having that testing kit would allow people to control more of their sexual health because they know where to get their sexual health needs met and have strategies. One of the other services in the short term that we're trying to really increase is just increasing our uptake of people who want to be in PrEP by training our Wellness Center and Health Services team in order to do PrEP visits. We're also bringing on a PrEP telemedicine provider in order to help us do that. Really leaning into telemedicine. We're already doing it before COVID. I want to say that we were cool before it was cool. We're now just cooler.